Hello there, grade 12 students! This academic year is definitely a phenomenal one, and I can't wait to witness how awesome you'd be. Welcome to our PE4 class, where there will be a lot of fun, learning, and challenges along the way. But you don't have to worry, because I'll be there for you. I am Angelica C. Santiago from 12 HUMSS 2, and I gotcha! In this study, we're going to explore first aid common unintentional injuries. Aren't you excited? So, without further ado, let's get started.
Good day everyone. For today's lesson, we will explore the topic of heat-related illnesses, also known as hyperthermia. As temperatures rise and extreme weather events become more common, it is crucial to understand the risks associated with prolonged exposure to high temperatures or engaging in strenuous physical activity in hot conditions. Heat-related illnesses can range from mild discomfort to life-threatening conditions, making it essential to recognize the signs and symptoms and take appropriate measures to prevent and treat them. By raising awareness about hyperthermia, we aim to promote safety and well-being during hot weather conditions. There are different types of heat-related illnesses, including heat cramps, heat exhaustion, and heat stroke.
Heat cramps, painful muscle spasms that usually occur during or after intense physical activity in hot weather. They are caused by dehydration and electrolyte imbalances. Did you know that too much exposure in heat and exercise can lead to heat cramps? Nagiging sanhi nito ang kakulangan sa sodium, potassium, calcium, and magnesium at kawalan ng asin sa ating katawan. Ano ang mga sintomas nito? Ang sintomas nito ay ang pagpapawis, pagiging mahinain, mabilis na tibok ng puso, pagduduwal, or pagsusuka. How to prevent? Paano nga ba ito ay iwasan? Madali lang. Number 1, maghanap ng lugar na masisilungan. And number 2, uminom ng maraming tubig or sports drink na may electrolytes.
Heat exhaustion, a condition characterized by heavy sweating, rapid pulse, dizziness, fatigue, and nausea.
Number 3, heat stroke, a lifetime condition where the body's temperature system fails, causing the body temperature to rise to dangerous levels above 104 degrees Fahrenheit or 40 degrees Celsius. Heat stroke requires immediate medical attention and can lead to organ damage or death if not treated promptly. Symptoms include confusion, rapid breathing, racing heart rate, and loss of consciousness.
It occurs when the body loses too much water and salt, usually due to prolonged exposure to high temperatures and inadequate fluid intake.
Heat stroke is the most serious heat-related illness. It occurs when the body can no longer control its temperature. The body's temperature rises rapidly. The sweating mechanism fails and the body is unable to cool down. When heat stroke occurs, the body temperature can rise to 106 Celsius or higher within 10 to 15 minutes. Symptoms of heat stroke: confusion, mental status, loss of consciousness, hot, dry skin, or profuse sweating.
Poisoning. Poisoning occurs when a person ingests, inhales, or comes into contact with a substance that is toxic to the body. These substances, known as poisons, can cause a wide range of symptoms and complications depending on the type and amount of poison involved.
There are some common types of poisoning. Number 1, ingested poisoning. This form of poisoning happens when someone consumes a harmful substance like household cleaners, medication, or chemicals. Symptoms can range the nausea, vomiting, and abdominal pain to diarrhea, dizziness, confusions, and breathing difficulties. Number 2, inhaled poisoning occurs when harmful substances are breathed in like carbon monoxide emitted by malfunctioning gas appliances, smoke from fires, from chemical fumes. Symptoms can manifest as headache, dizziness, breathing issues, confusion, or even unconsciousness.
Contact poisoning. Contact poisoning occurs when toxic substances come into contact with the skin or eyes, such as certain plants, chemicals, or pesticides. To put it simply, contact poisoning happens when you allow those harmful substances make contact with your body. Symptoms may include skin irritation, redness, rash, blistering, burning sensation, and eye irritation. Number 4. Injected poisoning. Injected poisoning involves the introduction of toxic substances directly into the bloodstream, typically through insect or animal bites or contaminated needles. Symptoms vary depending on the type of poison injected and may include pain, swelling, redness, numbness, and systemic effects. If symptoms are severe or persistent, it's important to seek medical attention promptly.
Insect bites. Insect bites are injuries caused by the injuring of the skin by insects such as mosquitoes, fleas, ticks, bees, wasps, or ants. These bites can lead to a range reaction from mild irritation to severe allergic reaction or transmission of diseases. Here's some common types of insect bites. Number 1. Mosquito bites usually cause red, itchy bumps on the skin. In some cases, they can transmit diseases such as malaria, dengue, fever, or Zika virus.
Tick bites. Tick can transmit diseases such as Lyme disease and Rocky Mountain spotted fever. Tick bites can cause redness, swelling, and sometimes bull-eye rash around the bite site. Bee and wasp stings. This can cause immediate pain, swelling, and redness at the site of the sting. In individuals with allergic bee and wasp sting can trigger severe allergic reaction, including anaphylaxis.
Number 4. Flea bites. Flea bites typically appear as small red bumps that may be itchy. Fleas can transmit disease such as plague and typhus, although these are rare in most development countries. Ant bites. Depending on the species ant, bites can cause redness, swelling, and pain. Some ants, like fire ants, can cause painful and itchy pustules at the bite site.
Drowning occurs when a person spends too much time with their nose and mouth submerged in a liquid to the point being unable to breathe. If this is not followed by an exit to the surface, low oxygen and excess carbon dioxide in the blood trigger a urological state of breathing emergency, which result in increased physical distress and occasional contraction of the vocal folds. Significant amount of water, usually only enter the lungs later in the process.
Hi everyone, today we are going to tackle about the different types of drowning. The first one is wet drowning. This is the most common form of drowning where water enters the lungs and impairs the person's ability to breathe. Wet drowning typically occurs when a person is submerged in water and cannot reach the surface for air. The second one is dry drowning. In dry drowning, the person's airways closes up due to a spasm, preventing water from entering the lungs. However, the lack of oxygen still leads to unconsciousness and eventual death. Dry drowning can occur even after a person has been rescued from the water, as the airway can close up several hours after the initial incident. Third is secondary drowning. This type of drowning occurs when a small amount of water enters the lungs, causing inflammation and the buildup of fluid. Over time, this fluid buildup can impair the person's ability to breathe and lead to drowning. Secondary drowning can happen hours or even days after the initial water exposure. The fourth is silent drowning. Silent drowning refers to cases where a person drowns without exhibiting the typical signs of struggle or distress. In many instances, the victim may appear to be swimming normally before slipping beneath the water's surface. Silent drowning often occurs in young children who have not yet developed strong swimming skills or in individuals who experience a sudden medical issue while in the water. The last one is secondary drowning, also known as delayed drowning or dry drowning, occurs when a person inhales water into their lungs, leading to inflammation or swelling that cause breathing difficulties after the initial incident. This condition can develop hours after leaving the water and requires medical attention.
Actions to prevent drowning covering mesh using doorway, barriers and playpens, fencing swimming pools and otherwise controlling access to water hazards greatly reduce water hazard exposure and risk. Community-based supervised childcare for preschool children can reduce drowning risk and thus other proven health benefits. Teaching school-age children basic swimming, water safety, and safe rescue skills is another approach, but these efforts must be undertaken with an emphasis on safety and an overall risk management that includes a safety tested curricula, a safe training area, screening and student selection, and student instructor ratios established for safety.
When something gets stuck in your throat, making it hard or impossible to breathe because it blocks the airway. Choking occurs when an object or food obstructs the air passage, leading to breathing difficulties or an inability to breathe. Altogether, choking is a medical emergency that occurs when someone's airway becomes blocked, restricting airflow to the lungs. It can happen when a foreign object such as food, a toy, or another item gets stuck in the throat. If someone is choking, it's important to act quickly to help dislodge the obstruction and restore normal breathing.
There are different types of choking. Number 1 is food choking, when a piece of food gets lodged in the throat, obstructing the airway. Number 2 is foreign object choking. There are different types of choking. Number 1 is food choking, when a piece of food gets lodged in the throat, obstructing the airway. Number 2 is foreign object choking, when non-food items like smaller toys, objects get stuck in the throat. Number 3 is chemical choking, inhaling or ingesting toxic substances that causes respiratory distress. Number 4 is medical condition choking, conditions like anaphylaxis, where swelling in the throat obstructs airflow or seizures leading to aspiration of saliva or vomit. Number 5 is psychological choking. Performance of anxiety or panic attacks can cause a sensation of choking, even if there's no physical obstruction.
Postpartum hemorrhage is a common condition in women even without risk factor. To minimize its effects, physicians should identify and correct anemia before delivery. Be aware of mother blood's transfusion belief and eliminate routine episiotomy. Active management of third stage of labor, which includes administering a euthanauric drug control, cord contraction, and early cord clamping and cutting, is the best preventive strategy. Delaying cord clamping for 60 seconds can increase iron store and decrease anemia, especially in preterm infant and low resources settings. Prophylactic administration of oxytocin reduces postpartum hemorrhage rates by 40%, and misoprostol can also used to prevent hemorrhage.
Prevention. Hemorrhage prevention refers to the strategies and measures taken to reduce the risk of excessive bleeding or blood loss caused by injury. Medical conditions or procedures. This can include prompt treatment of injuries, managing medical conditions that increase the risk of bleeding using techniques to minimize blood loss during surgery, and monitoring patients closely for signs of bleeding. Hemorrhage prevention is important for maintaining the stability of a patient's circulatory system and preventing potentially life-threatening complications.